full-service population health management company servicing corporations, insurers, and public agencies across the nation. Gary received a BS degree in education from Washington and Jefferson College and an MS in cardiac rehabilitation from the University of Pittsburgh. Mr. Sams is a popular speaker, as we can tell by our numbers today, and a writer on health topics, and has been published or quoted in several local and national publications. As the Chief Wellness Officer for Be Better Health, Mr. Sams has been responsible for the direction, implementation, and evaluation of a wide range of programs and services affecting over 3 million individuals across the country. We also have Cameron Smith with us. Cameron is a graduate of the University of North Carolina at Wilmington and has worked in the tobacco cessation arena for 8 years. She started as a tobacco cessation counselor at the American Cancer Society and then working with state governments and Fortune 500 companies to implement and manage their tobacco cessation programs. She has helped over 200 corporations, hospitals, and other organizations to design and promote their tobacco cessation benefits for employees. And we're pleased to have both of them with us today.
Kelly, thank you very much for the introduction. And Michael, I want to thank you as well for facilitating the presentation this afternoon. And I also want to thank you overall for your work that you're doing in providing these webinars. You're really doing a great service to our industry and health promotion, and really applaud your efforts there.
Thank you.
As Kelly mentioned, my name is Gary Sams, and I'm the Chief Wellness Officer of Be Better Health. And Cameron and I want to start by thanking all of you for attending this afternoon. We've outlined some objectives that we have for the presentation here, and the presentation will actually roughly follow the objectives that we have laid out here. But I think our overall arching goal for the presentation is really to provide you with information and resources to really help you address this challenge of effective tobacco use policies and tobacco cessation programs. And so our hope is that if you don't have a current program and policy in place, that again will give you the resources to really help you address that challenge. And if you do have an existing program, well, you'll pick up some information that may help you to improve that. I want to start by providing just a little bit of background on our organization, Be Better Health. We're really one of the pioneers in the health and wellness space, and our programs and services really range from the traditional biometric health screening and health risk assessment work. We've been in well over 1,000 workplaces to date providing those services, and more recently we've transitioned from those more traditional services to really next generation services that are web-enabled, services, software, platforms that are really designed to enable and facilitate comprehensive and integrated health and wellness programs. And through the course of our history and doing all those screenings and assessments that I was discussing, we really came to realize that if we could just, in working with our clients, make an impact on kind of 3 essential areas here, which we refer to as the wellness essentials, and that is getting people to practice better nutrition, eating better, getting them to get enough exercise, and in particular, not using tobacco products. Well, we'd make a huge impact on the health-related cost of that organization, as well as the quality of life that individual employees and participants experience. And so over the recent years, we've really put an emphasis and focus on these wellness essential tools. And this sentiment certainly is shared by others. You look at studies like the EPIC study and CDC publications, that making an impact in these essential or core areas of someone's health practices really does make a huge difference on chronic disease risk. One of those wellness essentials, of course, is tobacco cessation, and I want to provide a little bit of background information on our work in that arena. We've actually been at this for a long time, since 1977 rather. If you look at the work of our wholly owned subsidiary company, Smoke Stoppers, And some of you on the call will recognize that name. It's kind of the grandfather, if you will, of the tobacco cessation programming movement. And in the early days, these programs were really more group-based, and we still provide group-based programs through community hospitals and larger organizations where you can get a number of individuals together in one place, usually 10 to 12 people, and they'll meet for 8 to 10 weeks and go through the cessation process together. And as I said, we still provide that service, but the services have really migrated away from those group approaches to more individualized approaches. And Cameron's going to get into the details of those programs as we go through the presentation. But our efforts have certainly evolved over time as well. And the image that you see in the upper right is a screenshot from a program that we just launched this past month called BreatheBetter.me. And I'm going to go into more detail on that particular program at the end of the presentation. Some of the other tobacco cessation products and services that we're involved in are listed below here. And program consultation and evaluation, we do a lot of work in helping state quit lines with their programs. And we've been involved with 12 states in some form or fashion in dealing with components of their programs. We do a lot in the area of NRT sales because we're big believers in the approach that marries pharmaceutical support to address nicotine addiction, the physiologic addiction to nicotine, as well as behavioral approaches like health coaching, education, awareness building, those avenues as well. We distribute millions of dollars of NRT every year, and again, are a big believer in their role in effective programming. As I mentioned, we do a lot in web-based programming as well, market support, and on the coaching front, we employ several health coaches that provide traditional telephonic health coaching and moving into web-based coaching as well. One of our large efforts is with the state of West Virginia, where we manage and provide all the coaching services for that state's tobacco quit line. I want to lay a little bit of groundwork and background information on the current state of tobacco use in the country. And our timing is pretty good today in that just yesterday, I'm sure many of you are aware, was the 37th annual Great American Smokeout. So while I'm happy to report we've definitely made progress in the area of tobacco cessation, over the last several decades, there's half the amount of tobacco use as there once was. But unfortunately, over the last 5 years in particular, we've sort of stalled that dramatic progress. And today, approximately 20% of the population continues to use tobacco products. And I wanted to highlight some of the facts about that tobacco use. And this is information kind of hot off the press, if you will. The source of this data is the Morbidity and Mortality Weekly Report that was published on November 9th of this year, looking at cigarette smoking among adults in the U.S. And I pulled out 3 points that I thought that were particularly meaningful, and that is that the amount of heavy tobacco use in the country, greater than 30 cigarettes per day, is on the decline, and so that's good progress for us. And while even smoking 1 cigarette per day is not good, and it still qualifies as a tobacco use, and we want to end all tobacco use, certainly from a long-term cessation success standpoint, we'd rather see people smoking less than more. Another development that I think is promising for us that are really trying to address this challenge is that if you look at the younger group of tobacco users, 18 to 24-year-old, we've seen a real decline in their use from 2005 to 2011. And I chose to highlight that particular stat in that I think that it's reflective of the value of effective smoking cessation policy. And if you had to sort of quote a national quit rate, if you will, annual quit rate, those in public health and in academic circles would put that at approximately 4% per year. But what we know in modeling the effectiveness of tobacco policies, so things that look at effectively communicating program availability, clean indoor air policies, increasing the amount of compensation for those that are providing cessation services, all of those types of policies, if we would move those to a best practice approach, we could increase that annual quit rate from 4% to over 8%. So policies and the way that you address the environment of tobacco use really do make a difference. Wanted to also look at what employers are doing in their current response to the tobacco use challenge. And this particular exhibit is right from the Kaiser survey of employer-sponsored health benefits this past year, 2012. And what we're looking at is offering of particular wellness programs by employee size. And what I wanted to point out here is that we've got some good news in that large employers, and by large employers, their standard for that qualification is those with 200 or more workers. It's about 70% are offering smoking cessation programs, and that's actually the second highest offering, just behind web-based resources for healthy living. On the other hand, unfortunately, if you look at smaller firms, only about 28% are offering smoking cessation programs. And so I think that's an area that all of us on the call, if you're working in with a small employer, or you are a small employer yourself, that's a challenge that we really need to address. And of course, it's even more important and meaningful in that we know that the majority of employers in the U.S. are small employers. So that's an area that we really need to attend to. Getting ready to make the transition for Cameron to really address in more detail some of the practical aspects of these programs. But before I do that, I want to also kind of some housekeeping about the presentation today. You'll notice as we go through it that we're going to highlight, by labeling recommended reading, a number of publications. And in keeping with our overall goal and objective, again, of getting you the resources and information you need to either start or improve your programs, we really tried to do our best in picking some great resources to share with you. And so one of those is highlighted here. This is the fundamentals of smoke-free workplace laws. And as you can see, this was really an effort by a number of organizations like the American Cancer Society and others to put this document in place. We're going to really focus now again on some of the more practical issues of our challenge with smoking policy and cessation programs, looking at hiring policies, benefit design, particularly in the area of premium differentials, and the role of employee health and wellness programs. And with that, I'm going to invite Cameron to join in.
Thanks, Gary. So what we're going to look at as far as tobacco cessation programming trends is really dive into what types of goals companies tend to have before implementing a tobacco cessation program, the different types of programs that are available in the marketplace, and what makes a successful tobacco cessation program, and as part of that, incentives and premium differentials and how they support that success. And then we'll get into the program planning of the premium differentials and incentives, as well as the tobacco cessation program, and what goes into communicating an effective tobacco cessation program. So let's get right into talking about program goals. Tobacco use, as Gary mentioned, is the #1 cause of preventable death, and the CDC has stated that tobacco cessation is the single most cost savings benefit you can offer your employees. It accounts for, tobacco use accounts for high health care claims, lost productivity, increased disability, and workers' comp claims. So as the discussions increase about what an employee's health costs, many are looking for ways to change company culture and encourage employees to get healthier, and part of that is quitting tobacco. So tobacco initiatives like implementing and strengthening a tobacco-free campus policy, and then implementing incentive benefit design changes, these things are really leading the way as far as tobacco initiatives are concerned. So according to the CDC, unlike smoke-free indoor policies, which were really popular years ago, tobacco-free campus policies are not solely designed to protect non-smokers from secondhand smoke, but they're intended to encourage employees to improve their health by quitting tobacco. And tobacco-free campuses create work environments in which tobacco users find it easier to reduce their consumption or quit altogether. So we're going to do a polling question now. And the question is, does your company have a tobacco-free campus?
So just type your questions, type your answers into the box, into the chat box, just yes or no.
And we'll just give a little bit of time for the results. And actually the question is, do you currently offer a formally structured tobacco cessation program for your employees? And so are the results ready, Michaela?
Just a minute, because the number of people are still voting furiously, so I hate to cut them off.
Okay.
I actually misled people. You don't have to type.
Okay. Yeah, I'll give you guys another 10 seconds. Okay, here's come the results.
Okay, great. So it does look like a majority of you do. 58% of the people attending today do have a tobacco cessation program in place. So as part of that, you may want to consider, if you don't already have, a tobacco-free campus policy to go in conjunction with your tobacco cessation program. For those of you who do have a tobacco-free campus, you'll find that tobacco policies can influence behavior change, and more is known about the effects of secondhand smoke, which is especially concerning for hospitals and healthcare systems who allow employees to smoke in designated smoking areas. And then, of course, adding or strengthening a policy is a great opportunity to draw attention to employee tobacco use and offer employees the opportunity to help them quit tobacco so they feel supported with a change. The big change being that you're moving towards a tobacco-free campus. Ultimately, these programs are intended to help improve employee health, and that's the primary goal behind any tobacco policy, premium differential incentive, any type of plan design change. Companies are wanting to improve employee health, and that's really the background and the piece that's driving any of these initiatives. So we'll move on to the next slide and talk about the different types of programs that are available in the marketplace. Now, these are the different types of programs that employers have found to be most effective with improving employee health and helping their employees quit tobacco. When employers first began offering tobacco cessation years back, it was most likely in the form of an on-site class or face-to-face counseling. And face-to-face programs are effective. However, the challenge they present is with program participation. Employees often don't feel comfortable going to a class where they would sit beside someone they know or expose themselves as a tobacco user if they're not someone who typically smokes in front of others. Or they may not want to expose the fact that they want to quit tobacco. Maybe it's a personal decision. So attendance in on-site programs can be a challenge. The web-based programs have taken off in recent years, obviously because of more people having access to the web. And many web-based programs have community support tools where you can join groups online to encourage each other and get the benefits like you would in a face-to-face or a group setting. And web-based tobacco cessation programs also have fun tools like tobacco calculators where you can track how much money you're saving with not using tobacco. And they also offer great information and videos and tips on how to create a quit plan, get access to nicotine replacement products and other medications. And web-based programs on their own have shown to be very successful. They have a 20% absence rate at 1 year. So low cost, easy way to offer support to employees. Now texting and mobile apps support is something it's also a growing area, and we really expect this to be something to be really expanding in the next 5 to 10 years. Most of the tools that exist today are similar to the web-based support. The texting support piece is something that is that can provide real-time coaching via text message, and it really can open new doors in regards to preferred methods of communication for getting support for tobacco cessation, especially for the younger generation of tobacco users. And then telephonic coaching. It's the preferred way by most companies since it is convenient, it's effective, it's a one-on-one way to help participants on an individual level, and it allows participants to take calls during their busy schedules and also offers an easier way for employees to engage in the program. So when evaluating programs, you'll want to consider your employee population, how they will access the program. The type of program offered can make a big difference in the success of any changes going on with your policies or with your plan benefit design. So when considering these types of different types of programs, it's important to know the factors that make a successful tobacco cessation program. So we'll move on to the next slide that talks about the key variables of a successful tobacco cessation program, which are participation rates and quit rates. Tobacco cessation programs are one of the easier wellness programs to measure success. Either you're quit tobacco or you're not. And like with most wellness programs, participation is an important part of being successful. With tobacco cessation especially, you have to have that participation in the program in order to arrive at a statistically significant quit rate. So when selecting vendors, you want to look for a vendor who has somewhere between 5 to 10% annual participation rate. Now, when you're looking at the numbers, you want to estimate that the national average is for tobacco prevalence is 20%. And that's a good number to use when trying to figure out how many tobacco users you have at your organization. Typically, blue-collar companies, manufacturing have a higher tobacco prevalence, and some of your white-collar and also healthcare and hospitals have a little lower than the national average. But going with these 20% of your population is a good place to start. So annually, between 5 and 10% of the eligible tobacco users enrolling is a good number to expect for participation rates. Quit rates are also very important. It's important to ask your vendor who is measuring their quit rate how they arrived at that number, because there's no standard in the industry for quit rates. So sometimes you'll hear companies talking about they have a 80–90% quit rate, and most likely they're evaluating that based on the people who have completed the program. And a good conservative quit rate will calculate and include those in the denominator who have enrolled in the program, not just those who completed the program. So it's really important to ask questions and find out how the vendor is evaluating those quit rates and how they arrive at their numbers. With both participation rates and quit rates, the factors that go into making these two areas successful are vendor selection, communication, and incentives. And incentives are especially important because they can directly impact the success of your program because of the financial motivation they offer. So moving into the types of incentives, and we can see evidence of where tobacco users are motivated by finances. During the 2009 federal tobacco tax increase, we saw a dramatic increase in call volume to state quit lines. So although the quit rates did not increase during that time, more people called in, and therefore it resulted in an increased number of people quitting tobacco. So the most common incentive that is offered by employers is charging a higher health insurance premium to employees who use tobacco, or providing a discount to those employees who do not use tobacco. There are many types of premium differentials, but when they are successfully executed, they deliver a positive message about the importance of quitting tobacco, and they can also finance the program you're offering them. Additional methods of tobacco incentives is to offer a wellness credit based on a certain criteria, including a credit if you're a non-tobacco user. And also, you can contribute to healthcare spending or flexible spending accounts. That's a common practice as well. But the premium surcharge discount makes the biggest impact on employees and really draws attention to the one aspect that could change the amount they're spending on a monthly basis. It directly impacts their paycheck. So as far as premium differentials and what you want to think about when you implement a premium differential is you want to identify your tobacco users. And that's a big question a lot of people have, is how do we know who our tobacco users are? Well, when you implement a program, a key piece is you'll want to identify them either with an affidavit or using your HRA or perhaps using biometric testing and coating testing. The affidavit is the most common. It could mention that they, in the affidavit language, you can mention something that the employee could be subject to testing. If they were found to be lying, it can be grounds for losing their job possibly. That's some pretty strong language. But the affidavit could be in a paper format or electronic, and it could also be in the employee HRA. Coating testing is a way some employers are finding out who their tobacco users are. Most often it's done randomly, and the threat of being tested is often enough to encourage employees to be more honest on the affidavit or when they're certifying their tobacco status. Ultimately, it's important to consult with your legal counsel if you're considering coating testing. That's definitely something that you'll want to run by legal before you implement anything like that. A successful premium differential requires having a comprehensive plan in place. So let's talk about having a program plan for incentives. Now, having as much time ahead of the premium differential implementation as possible, giving notice to the employee as much time in advance is important. We recommend 6 months to 1 year. Giving a tobacco user the power of choice with a nudge is always better than just throwing it on them to quit tobacco on their own in a short period of time. Also, it's important to allow a tobacco user to be rewarded on participating in a program to try to quit versus just rewarding tobacco status. It's definitely a best practice to encourage them to try versus just if they're a tobacco user or not. Also, by rewarding the employee based on participation, it's encouraging to them because most people, it takes them about 7 tries before they're able to quit for good. So by rewarding them by participation, you're encouraging them to try again. Also, you'll want to allow the participant to earn the incentive year-round. They do not want to wait a full year before they have the opportunity again. Maybe it just wasn't the right time, right at open enrollment. Maybe they will have a better opportunity to quit tobacco successfully, say in the summertime or at a different time. So giving them the opportunity to earn that incentive year-round is definitely a best practice. And you'll want to have a clear communication strategy. You want it to be clear and concise, and you want to message to the employees exactly what needs to be done in order for them to earn the non-tobacco user rate. So let's talk about having a clear communication strategy. Now, everybody's heard of the carrot versus stick approach, and some would consider that no matter how you phrase it, premium discount for non-tobacco use or tobacco use surcharge, they're both a stick approach. However, the way you phrase it and the way you communicate it, using the non-tobacco use discount is definitely more popular. and it seems to go over more smoothly. Even if you don't include spouses in the incentive itself, you should strongly consider offering the tobacco cessation program to spouses. For tobacco users who are trying to quit, if they go home and their spouse is still smoking, it's going to make it really hard for them to be successful. So you want to provide support to the whole household, to spouses, adult dependents. It's a good idea to offer them the program. You can include them in the incentive, but definitely offer them the opportunity to use the program as well. It's going to help your employees. And as you select a tobacco cessation program to fit your needs, make sure that integration with your premium differential is easy. If you're using a telephone quit line, for example, you'll want the coaches who are interacting with the participants to communicate with them exactly what they need to do to earn the lower rate. So if they're on call 3 and they need to complete 4 calls, then the coach can communicate that to them along the way. Also, your vendor needs to provide you with a report that tells you who has completed the program so that they can earn the incentive. It's better just to have the vendor provide you that information versus the employee, relying on the employee to bring you some type of certificate of completion. It just keeps everything very streamlined and clean. It's also helpful for the program vendors that you select to make outbound calls to tobacco users to see if they're ready to enroll. You may want to include a question when you have them certify as a tobacco user. You can include a question like, would you like assistance with quitting tobacco from an employer-sponsored tobacco cessation program? And if they indicate yes, then you can provide their information, their name, to your vendor, and they can make outbound calls to that individual to see if they're ready to enroll. This, of course, is only appropriate for companies that type of outbound calling would fit in your culture, but it's definitely a great way to encourage tobacco users to enroll in the program. Also, a letter to employees from your executive management CEO can make a big impact on your employees' choice to try to quit tobacco. It really delivers a clear message from the top that your company is serious about the health of your employees. While it is important that your executive team supports the program and the communication of the tobacco initiative, it is also important that they look at the impact of the legal considerations. And with that, I'll turn it back over to Gary Sams to talk about that.
Cameron, before we move over to some of those details, would we be able to do another poll of the audience to see their use of premium differential?
Yes.
Yeah, we can do that.
Michaela, would you have that polling question?
Yep, there it is. I just launched it.
Okay, great. So the question is, do you currently have or are you considering adding a tobacco use premium differential?
Okay, and I'll give you about 30 seconds to get your answers in. Okay, in about 10 more seconds. Okay, and there's your results.
Okay, great. So it looks like 57% of you do not have a premium differential and 43% do. So this is definitely a growing area, especially with some of the changes with healthcare reform. So definitely interesting numbers there. And for those of you who don't have a premium differential, that definitely may be something you would want to consider in that it can help motivate behavior change with your employees. So now I'll turn it back over to Gary to talk about the legal considerations with any type of benefit plan design changes.
Thank you, Cameron. And that's a good transition, and good to know how the audience is looking at using this as a tool for their tobacco cessation programs. And as Cameron mentioned, as we get into some of the details now about these policies and programs, it really is a good idea to engage your legal counsel or your health benefits advisors in this process. And out of full disclosure here, I'm not an attorney myself, and I've never played one on TV. So again, really encourage you to take advantage of the resource that you have to address these particular issues. I do have a recommended reading for you, though, however, that I would strongly encourage you to access, and that is a great article that came out just last month that Jill Cohen had in Human Resource Executive Magazine. It was titled "The Trouble with Tobacco Testing," and she really engaged a number of individuals that had experience and insight into this process and into the issues around tobacco testing. And so, again, I would encourage you to access that article. Some of the things that, the points that we want to make, though, from a legal standpoint, are that it's very important for you to understand that state laws vary around the country. And particularly if you're an organization that has employees in multiple locations, you really need to understand what the laws are in that individual state because, for example, South Carolina has very rigid laws and statutes against, or for rather, smokers' rights. So it's a challenge for these programs and policies to be put in place in light of those state laws, where states like Ohio have more liberal rules and guidance in that area. So the types of things that you can do there are quite different. So again, understand what's applicable to your particular situation and your organization. Another key point that I want to get across is that regardless of the legality of doing tobacco testing, it doesn't necessarily mean that it's the right thing for you to do. And that's particularly true in light of your organization's culture and the environment that you have there. Would doing mandatory tobacco testing, for example, make an impact on the trust that your employees feel for the organization, or make an impact on morale and therefore productivity? So that's not a legal issue, but it's just as important when you're thinking of the impact of your program. Our intent, of course, is to do the right thing and to have a program that helps people, but sometimes that effort can get complicated and backfire a little bit if we don't think these things through in advance. Some of the other issues that I think are important to consider in regard to tobacco testing in particular is that there are a lot of factors that can complicate the issue of whether someone tests positive or not for nicotine use. And so, for example, if they live with a heavy smoker and have a lot of exposure to secondhand smoke, it's possible that they could test positive for nicotine. Another area that we never had to consider when we first started in these efforts years ago is the rising use of e-cigarettes. And while we're not a proponent of e-cigarettes, and the FDA hasn't weighed in on their safety yet, there's no denying that their use is growing. In fact, in researching for this presentation, I accessed an article from the journal, a trade journal that is used by the convenience store industry. And one of the statistics that they gave from a marketing perspective was that in 2011, about 23% of convenience stores sold e-cigarettes, where this past year, 2012, 58% of convenience stores are now selling e-cigarettes. So there obviously is a growing market and a demand for the e-cigarette. And while it is not smoking per se, it's a different form of delivery system for nicotine. Again, that has to be considered when you develop these policies. So again, the note here, the takeaway is that engage your legal counsel, your health benefits professionals to really address this issue because it's more complicated than it may look at first glance. Another factor to consider when, particularly from a wellness side, you're looking at premium differentials and tying them to your wellness program participation and your wellness program design. Here again, I've got a good resource for you. It's posted on our website, and this is actually a tool that we developed here over the past several months, and that is how to strategically tie your wellness program to a benefit plan design with premium differentials. And so this is a white paper that we produced. I'm very proud of it. It gives a lot of detail and a lot of assistance in you considering the do's and don'ts of developing a program like that. Again, that's available on our website, and I'll reference it again towards the end of the presentation. But from the wellness perspective, we have a fairly clear guidance of what you can and can't do, and I wanted to just briefly point out some of the main issues to address. First of all, today, this year, the differential can't be greater than 20%. Now that changes in 2014 to being available at 30% differential, but today it can only be 20%. The program must be tied to a bona fide wellness program, and that means a program that, excuse me, is really designed, excuse me, and capable of producing behavior change and improving the quality of life for your participants. You have an annual qualification for the premium differential. So just because, for example, in the case of smoking based on tobacco use, just because someone would declare that they're a tobacco user this year doesn't mean that they're not eligible to reapply for that benefit the following year. You also have to provide alternative standards if there's a medical exception for meeting that particular standard. So while in the case of tobacco use, that's really seldom seen, if it were to be made as a legitimate argument that the individual has a medical exception to why they would test positive for nicotine, you would have to offer an alternative, for example, them participating in a program to address tobacco use, for example. And successfully completing a program could be a reasonable alternative to that. And the disclosure of alternatives is also a requirement. So in your marketing materials, your flyers, the communications that you have with your employees, you always have to disclose that there's an alternative to the standard. Again, I really point to that document that I referenced that we've produced. It will really provide a great deal of detail and information for you in that area. I want to talk just very briefly about the ROI issue because that also comes up when we're talking with organizations that are considering the development of these programs. There's obviously both direct and indirect costs when we think of tobacco use. Most of us, the thing that immediately jumps to mind is that there's increased health insurance costs and claims for a tobacco user versus a non-tobacco user. And that's certainly true. Most of us, the literature, most commonly in the literature, they'll state a number like $4,000 annually as a difference between tobacco users and non-tobacco users. The reality is that number is somewhat dated. If you brought that number into current dollars, it's more like $8,000 being the difference. And so there is a significant cost differential from a healthcare perspective. On the indirect side, from a productivity stance, there's obviously a cost there as well. If someone is taking a tobacco break, they're obviously not doing the work that they're assigned to do, and that certainly accrues over time and is costly for an organization. There's a number of other factors that also need to be considered that are more indirect from that perspective. I'm not going to spend a whole lot of time on this particular slide. Needless to say, we're big believers in the positive return on investment for efforts in tobacco cessation, and objective studies and data certainly bear that out. I wanted to provide you with a few examples of that, both from a healthcare cost and a productivity standpoint. But what I won't do is just provide a blanket, here's the ROI that you can expect, because there are so many variables that need to be considered in estimating or determining what your potential ROI is for these efforts, that I think we do a disservice by just saying that, well, you can expect a 3-to-1 or 4-to-1 return on investment. So rather than do that, I want to provide you with a tool that will provide a much more accurate estimation of what you can expect. And this is a tool that was developed by the organization America's Health Insurance Plans, and it was developed with a grant by the CDC. And we've provided a reference here for you, the businesscaseroi.org. And their calculator, I'm a big fan of it because it allows you to manipulate variables that are unique to your organization. So it's highly configurable by way of your population, your age groups, males, females, your smoking prevalence, the state that the majority of your employees live in. If it's representative of the state population, that gives you, again, more insight into use. The cost-related factors that you can manipulate, all of those things make for a much more precise estimation of your potential ROI. So, again, would highly recommend that as a useful tool for you. I want to also focus on some additional employer resources here. We've tried to pull out some of the things that have been most helpful to us in the past and that we feel represent really good quality information for you as well. So, this document, the presentation today, I know that it's archived through Health Promotion Live. It's also going to be available on our website, so I would encourage you to check out these additional resources. A final resource that I want to talk about, and I mentioned it at the very start of the presentation, is a new program that we've launched just this past month, and it's breathebetter.me. And this is a web-based program that's free. So if you're an organization, and particularly I made a point of pointing out that for smaller organizations, we're not having much success in getting them to adopt tobacco cessation programs, something like 28%. Well, this would be a great tool and a great resource to make available to them. It really represents our latest thinking in tobacco cessation. It's a highly customized program. It's tailored to each individual's own tobacco use experience, their history, their previous quit attempts, the barriers that have kind of stood in the road of their successfully quitting tobacco. So we're very proud of it as a tool to help people quit. Now, there are components of the program that if a company wanted to do some private labeling, or if they're going to embed telephonic health coaching or some NRT options, we do have to charge a fee for some of those services. But the basic program itself, as we've designed it, is a free program. And we were able to do that through the help of one of our partners providing a grant for us to develop the program. So I would encourage you to visit www.breathebetter.me and hit the sign in for free button, join in for free rather, and you can access it and check it out for yourself. I'm sure you'll find something there for you. Finally, before we open it up to some questions, I want to thank you again for your participation today and your attendance in the webinar. Again, our objective was to give you information and access to resources that can really help with you either establishing a tobacco use policy and smoking cessation program or improving an existing policy and program. And I'm sure that in accessing the resources that we've provided here, you'll be able to do that. If you have follow-up questions, we have you can go to our website, and we have information. Cameron Smith, again, her information is there, and we would be happy to communicate with you on an individual basis with specific questions or help that you might need. Michaela, do you want to open it up to some questions?
Absolutely.
I think we have about 5 or 10 minutes.
Yep. We've gotten a lot of questions, really a lot of really good questions. Let me start with this one. Could you give an example of a company's timeline for implementing and communicating a premium differential?
Sure,
Cameron,
I'll take that. Yeah, I'll take that one. So as I mentioned in the best practices for implementing a premium differential, you'll want to think about implementing a program to support 6 months to 1 year in advance of when the premium change, or actually when they have to certify as a tobacco user. So for example, if you're wanting to implement a premium differential 1/1 of 2014, really the time to start thinking about implementing a program is 1/1/13, or at least 6 months prior to 1/1/14. And when you do that initial communication of the program, you can start to think about different times a year. January 1st is New Year's resolutions. It's a great time to implement a program. And you can even communicate the program along with messaging that in 2014, tobacco users are going to be paying higher premiums, or you can non-tobacco users are going to earn a discount for not being a tobacco user. So jump on this opportunity now and try to quit tobacco ahead of that. And then what we do here at Be Better is we support our clients throughout the year with different communication initiatives. There's different times a year, like January 1st and with New Year's resolutions and the Great American Smokeout. There's some times during the spring and summer months where people are trying to get healthier, that we can use those times of year to help communicate the program and that the premium differential is coming. Again, just that opportunity to give the employee to quit ahead of the premium differential is really key to the success of that.
That makes good sense. Okay, here's another question. You mentioned that your web program, breathebetter.me, is free. What's the average cost of the medication to help someone quit smoking or quit tobacco?
Okay, well that's a great question, and there's it's not an easy answer in that there's a real range of possible numbers there. Depending on the length of use that a program sponsor is going to provide, whether it's a 2-week supply, 4-week, or 8-week supply, the price is going to vary greatly. We recommended a minimum that a program sponsor a 2 to 4-week dose of the product, whether that's the patch, gum, or lozenges, and if possible, you also to include the option for prescriptive products like Zyban or Chantix. But certainly the most common over-the-counter nicotine replacement therapy is the gum, nicotine gum. And for a typical course of therapy of that program, you're looking at anywhere between, let's say, $60 and $100. So if you could budget, have a budget like that in your organization for nicotine replacement therapy, you'd be doing a great service to your insured and your members.
Okay, well, I think this next question kind of dovetails into that. What are employers? How are employers figuring out what that differential should be, and what's an average?
This is Cameron. So we the average premium differential, as Gary mentioned, it's 20% is what the law will allow now, and it will go up to 30% in 2014. It really depends on the organization, and you have to take into consideration the average salary. But we have seen anywhere from $50 to $100 a month additional cost for tobacco users versus non-tobacco users. But again, it really depends on the company and you know, how much the employees, the large percentage of those employees are earning.
Okay, well, here's an interesting question from Rex, and I'm very curious about how you deal with this as well. He says, currently, a change in smoking status is not a qualifiable life event to allow for changes in the premium rate during the plan year. What are the various employers doing to encourage cessation efforts mid-year, and what kind of rewards are they offering immediately in lieu of the, I guess, inability to change plan design in the middle of the year?
Yeah, that's a great question. I'll take a quick stab at it, and then Cameron, you can weigh in as well. You know, I know in our platform, in our portal, you know, it's integrated into an overall reward and recognition system. And so, while you're right, someone may not qualify for the premium differential, it doesn't mean that they couldn't qualify for other incentives that are established as a part of the wellness program. And that's what we encourage employers to do, so that someone who's engaged in the quit process, for example, can earn wellness points that at least give them some recognition and maybe also some financial gain just based on that status versus the overall premium differential. Cameron, do you want to add to that? Or?
No, I think you summed that up perfectly.
Okay, well, here's a question from Tim. Can you give an example of an online program with a 20% one-year quit rate?
I have a source that supports that, and I'll be happy to send that out. And I don't have that on me right now.
What, you're not wearing all your research?
I know, right?
Okay. Let's see. Deborah wanted to know if you could provide an example of an affidavit. Is there a template that exists in the world, or is it something you created yourself?
Yes. Yes.
Yeah.
We have a.
I'm sorry, Cameron. I would suggest that, you know, for that, that's something that we could also, if you're interested in that, you know, communicate with us directly, and we can provide you an example of that. It's not something that I can bring up on the screen, for example, now to show, but we certainly would be willing to share the affidavits that we use.
Okay. That's awesome. Here's a question from Chris. He says, I assume it's a he. Sorry if, Chris, you're a female. Can you cite any studies that have shown that higher premiums lead to the abstinence? Oh, I'm sorry, I can't read. Higher premiums lead to more attendance in face-to-face programs and high quit rates.
Okay, there's a couple parts to that question there. I'm not aware of studies that show an increase in access to face-to-face programming, if I understood that correctly. But there are several studies that look at you know, the cost consequence of tobacco use, which, you know, premium differential would certainly qualify as, and greater abstinence. So some of the things that I referenced in the presentation will point to that. And if you don't find the particular you know, link or study that you're looking for of what I supplied, again, please communicate with me directly, and I'd be happy to share that with you. In fact, just recently, the Cochrane Review, there was a 41 studies that were pulled from that to look at the impact of behavioral and pharmaceutical programming support and impact on cessation, and some of those looked at some of the cost consequence again and the impact. So there's a number of studies out there that we could share with you.
Well, I just looked at the clock and realized we've gone 4 minutes over, and I apologize for that. I try to be so prompt, darn it, but we've still got some more questions. But what I'll do is ask Kelly to send them to you with the evaluations and such, so that you can follow up on your own, if that's all right with you.
That'd be great. Yeah, and we really appreciate the opportunity to address those for you. And sorry that we didn't have time to handle all of them.
Well, it's a pretty popular topic, obviously, and lots of research coming out on it. So I appreciate you guys. I really appreciate you guys being on top of it, because it's a lot of information. I think you did a great job, and I really appreciate you being here. And thanks to everybody else for being here and asking such really great questions. And, Gary,
thank
for being
you.
Here.
Thank you very much.
All right. Take care. See you soon.
Okay, bye-bye.